Welcome to the session, The Highs, Lows, and Squishy Middle of Contraceptive Product Introduction. My name is Soumya Ramarao, and I am a Senior Associate at the Population Council. We are happy to invite you to this session that has been put together by CHAI, FHI 360, PATH, Population Council, and PSI. Next slide, please. We will begin this session by laying out the importance of introducing new contraceptives to the market. Next, we will share 8 key steps of product introduction and examples of how teams in Madagascar, Uganda, and Kenya have addressed common challenges. Product introduction requires action at both global and country levels. Today, we will focus on country-level steps. Please note that product introduction is not a linear process. Some steps take place concurrently or can be done in a different order, and you'll hear more about this from the other speakers. Next slide, please. As you all know, we need a variety of contraceptives to meet different needs, whether it is to avoid the first pregnancy or space the next, or to limit childbearing altogether. Furthermore, as individuals go through their reproductive life cycle, their preferences may change for different methods. Thus, adding new options to family planning programs can support people at where they are to achieve their reproductive intentions. We know that side effects are a top reason for discontinuation and non-use of contraception among those who wish to avoid a pregnancy. By expanding method choices, we can better meet the diverse needs and preferences of individuals at different stages of their lives. Next slide, please. Adding new contraceptives not only helps individuals meet their reproductive intentions, but it also helps countries to achieve development goals. For each additional method of voluntary contraception that's accessible to at least half of the population in a country, overall contraceptive prevalence increases by 4 to 8 percentage points, as shown by an analysis done by Ross and Stover in 2013. I hope we have convinced you that adding new contraceptives expands choice and variety to contraceptive users, while at the same time helping countries achieve their development goals. It is my pleasure now to introduce Devin Kane, a global manager at CHAI, who will walk us through the 8 steps of product introduction. Over to you, Devin.
Thank you, Soumya. Now we're going to run through 8 steps that are significant in product introduction in countries. I'll run through the first 2 steps. The first step is to coordinate with partners. Country governments, national coordination groups, and other stakeholders can all contribute in planning for introduction of a new method or product. When building the plan, it's important to consider a mixed health system approach. Segmenting the market can support coordination and distribution of the product through public and private channels. The second step is to assess product demand and market potential. It's critical to understand the views of potential clients and service providers and their perspectives on the value that a new product or method would add to the range of family planning options in the country. To do this, conduct consumer and provider research and segment consumers. Develop marketing materials and pricing strategies that balances consumer affordability and costs. Now we'll hand it over to Ashley Jackson, the ECO Project Deputy Director at PSI WCG Cares, to talk through the next couple of steps.
Thank you. The third step is to secure regulatory approvals. Work with the manufacturer to plan the packaging and register the product with the country's regulatory authority, which determines which products are allowed on the market. Fourth, link with supply systems. Map out the public and private systems for procurement, quality assurance, and distribution of the product, equipment, and supplies needed for use, and if relevant, for removal of the method. conduct quantification exercises that feed into procurement processes, starting with a small volume of the product during the initial pilot phase. Fifth, support quality service delivery. Develop a provider engagement strategy, for example, trainings, quality assurance visits, job aids, provider communication materials. This can support optimal inclusion of the new product in family planning, counseling, and service delivery. Build client capacity for use of self-care contraceptives, including through counseling by pharmacy and drug shop staff. Next, you'll hear from Jen Drake, who is PATH's Sexual and Reproductive Health Team Lead. Over to you, Jen.
Thanks, Ashley. The sixth step in the product introduction process is to create demand or raise consumer awareness of the new product within the context of informed choice. Demand creation should follow manufacturer and local guidelines for marketing of family planning products. Informed choice is a long time and essential aspect of family planning and presents a unique dynamic for family planning demand creation. Informed choice requires that clients have a thorough understanding of their contraceptive options. So, demand creation in family planning requires efforts that raise awareness of new options in clear and compelling ways, while also linking with broader programming that ensures clients have a thorough understanding of the full method mix, enabling them to make informed decisions. For example, demand creation might highlight what sets a new product apart from existing family planning options and also address where clients can obtain family planning services more generally. It is critical to plan activities like demand creation, supply distribution, and provider training in an integrated way to avoid creating demand in geographies where the product is not yet available. The seventh step is monitor and evaluate product introduction. This should always be approached with data for decision-making in mind. Consider why different stakeholders need different types of data and plan for how they will use it. Routine monitoring of product supply and distribution, provider training, and service delivery statistics across the public and private sectors can help track progress of introduction and scale-up and identify challenges early. It is ideal to leverage or build on existing systems for routine monitoring if possible. Evaluation efforts or even research may also be needed to address learning questions or knowledge gaps specific to a new product or intervention. And finally, the eighth step is planning for scale-up and sustainability. As Salmia said up front, these 8 steps are not intended to be sequential, and this planning should happen from the very beginning of the introduction process as partners tackle all other steps. Plan early for scale-up decisions and actions, such as adding the product to the essential medicines list, the national training curricula, and guidelines for family planning health workers, and supply distribution and routine monitoring systems. Consider and plan for total market approaches to address the system-wide costs of adding the product to the method mix. Next slide. Before we hear from our colleagues on some of these introduction and scale-up steps in more detail, let's review what we've learned. Please take a minute to enter your response to the quiz question in the chat, and panelists will be on hand to see your answers and engage on any comments and questions. So please tell us which statement about product introduction is not true. You can enter your answer in the chat. A, it can be difficult to predict how many people will use a new product. B, it typically takes time and practice for FP providers to feel confident offering a new product. Or C, contraceptive products can be imported without regulatory approvals or waivers and permits. And now we'll hear about challenges associated with 3 of the 8 product introduction steps. While we don't have time to review common challenges for all 8 steps, we wanted to give you some examples of dilemmas that come up during the process of introducing new contraceptive products. We'll hear from 3 experts with decades of relevant experience. First is Dr. Jimmy Ramahavuri, a technical advisor for sexual and reproductive health at PSI based in Madagascar. Jimmy, over to you.
Thanks so much, Jen. Hello, everyone. My presentation will focus on demand generation challenges for family planning methods. When talking about introducing new FP methods, Identifying and highlighting the unique value proposition for each FP method is really important. Potential clients need to be informed of the new product and its unique value. However, uptake of new methods can take time and depends on multiple factors like rumors, side effects, rural versus urban geography, and so on and so forth. Additionally, local regulations in many countries do not allow mass above-the-line marketing of pharmaceutical products, which includes most contraceptive methods. So while condom brand can be advertised on television, injectables brand cannot. Without direct to consumer marketing, it can take a very long time for consumers to learn about new contraceptive options. How do you address these challenges in Madagascar and other countries? Here are some approaches we use to raise awareness of a new product as well as the range of other available contraceptive options. Community health workers and other interpersonal communication agents like peer educators speak with individuals and small groups in their communities. Clients typically feel comfortable speaking with them and trust their advice. Testimonials by satisfied early adopters also a good approach. This approach could be done in person during IPC activities using digital tools and social media, and even though mass media if country allows it. For example, a popular singer in Madagascar speaks on television about how she is happy that she adopted a copper IUD. Providers are key. It's important to train providers to add the product into counseling, job aids, below-the-line materials, example, posters, brochures, at service delivery points if it permitted. Providers of multiple health services such as childhood immunization can initiate conversation with clients about the range of FP options and note that the new options are available. Many countries, such as Madagascar, permit mass media marketing of family planning in general, as opposed to marketing of a specific method or brand. We highlight the availability of new options without naming specific products, prompting some consumers to find out more from their providers. When creating demand for a new product, it's important that we avoid creating more demand than we can meet with supply. If a product is only available in pilot sites, demand creation should be focused in those local areas until the product is more widely available across the country. Clients will feel discouraged if they seek out a new method and find that it's not available. They might not try again once it's available. Next slide, please. Let me end my presentation with this slide showing some examples of materials Madagascar is using to create demand. Here are some approaches we use to raise awareness of the hormonal intrauterine system in Madagascar. You can see the interpersonal communication agents, a poster for the walls of clinics, which appears next to the posters for other available methods, and the integrated job aids for providers. That's all for my presentation. Next, we will hear from Alan Namagembe. She's PATH Uganda Deputy Project Director and Monitoring and Evaluation Lead on the MPIC Access Cooperative Project. Over to you, Alan. Thank you.
Thank you, Dr. Jimmy. I'm going to talk in a bit more detail about monitoring and evaluation for introduction and scale up, and specifically the challenge of addressing continuously evolving data and learning needs for product introduction. On this slide, you can see 4 different challenges related to monitoring and evaluation, and 4 potential considerations to address these challenges. First, product introduction and scale-up is happening in a context of health markets and systems with many indicators, programs, and competing priorities. As Jen noted, data collected as part of introduction and scale-up should always be critical for tracking progress and making decisions. Second, it's important to remember that updating routine monitoring systems with new indicators for new products can take a long time. Early and clear planning for potential integration should happen from the beginning and help ensure that product introduction efforts can align with regular schedule of the Ministry of Health or partner updates to monitoring systems and indicators. Third, and related to the previous challenge, even with early planning, the timing of regular updates may not align with needs of product introduction and scale-up efforts. Partners should prioritize simple interim approaches to collect critical data and link with existing systems to help lay a foundation for integration down the road and for sustainability. Finally, remember that the health monitoring information systems, or HMIS data, cannot answer all questions. That's why we also talk about evaluation needs for introduction and scale-up. In addition to conducting standalone evaluations, you can also look to link with big surveys or broader learning projects if you have key questions that go beyond routine monitoring and limited funding. Next slide. Now let's talk about how some of these challenges played out in my context of Uganda as we have worked to introduce the novel self-injectable DMPA-SC in recent years. DMPA-SC can be administered by health workers or self-administered by FP clients themselves. When we first started introducing DMPA-SC injections in 2014, many stakeholders expressed a lot of data needs. We worked very closely with ministries of health, partners, and key donors to narrow down a few really critical indicators that could be monitored in the pilot across 4 different countries. In Uganda, this also gave us the opportunity to involve community health workers and build their capacity in monitoring for family planning, an important benefit for the whole system. This monitoring helped show us that the new product reached many first-time family planning users and young women. Questions about self-injection that were not possible to be answered through routine monitoring were explored through separate research studies instead. Even though we planned ahead and worked so closely with the Ugandan Ministry of Health, updates to integrate this new product and self-injection in the HMIS still took a long time. Throughout this period, we have also worked with PMA initiative to integrate DMPSC and self-injection in their survey as an additional information source. Now we are working on starting to collect data on self-injection through the routine systems. Thank you for your attention, and now I'm pleased to introduce my colleague, Dr. Masiden Solomon, a technical director and country representative for FHI 360 in Kenya. Over to you, Dr. Solomon.
Yeah, thank you so much, Ellen, for the kind introduction. As my co-presenters have already mentioned today, careful planning for sustainable scale-up is the key to success for new product introduction. But of course, this process can have many challenges. One key issue is that stakeholders, including government and donors, can experience product introduction fatigue. There have been several new contraceptive products that have been introduced in the past several years, as well as other health technologies. This can lead to feeling overstretched, especially in health systems that are weak or underfinanced. There is also a tension of whether there's also a tension of whether to focus resources in time and money on introducing new products versus strengthening and expanding access to existing methods. Contributing to this problem is that some groups, including NGOs, can sometimes operate in silos without awareness or coordination amongst ourselves. Key considerations to address some of these challenges include that it is critical that the government always be in the driver's seat when it comes to method introduction. This includes government at both the national and the subnational levels. It is also important to have intentional coordination among all the players, including NGO partners and donors, so that we can both promote new methods and expand access to the ones that are already available. Next slide, please. I am going to build on what previous presenters mentioned about the levonorgestrel releasing intrauterine device, also known as the hormonal IUD or the hormonal IUS. This is a highly effective contraceptive method that has not been widely available in Kenya and other middle and lower income countries, despite the fact that it was first introduced in Europe in 1990 and in the United States in 2000 and is popular in those settings. In the past several years, we have done a great deal of work to evaluate the potential for broader introduction of the hormonal IUD, including leading a market assessment with MSI in 2015, leading research also with early adopters of Mirena in Nairobi in partnership with FHOK, and conducting consumer insight research with PSI and Roots to Results. As you all see on this slide, coordination across all levels is critical. At the global level, there is the Hormonal IUS Access Group comprising of donors, procurement agencies, and NGO partners, which is working to address supply and demand side issues which have led to market shortcomings for the hormonal IUD. This effort includes working to achieve affordable pricing and adequate supply of commodities. At the national and subnational level, we have done a great deal of coordination work with the MOH and partners, as I'll discuss in the next slide. Next slide, please. Within Kenya, there is a growing interest in increasing contraceptive method choice, including expanding access to the hormonal IUD. As such, a two-day experiential learning site visit was organized in 2019 to the Kisumu County to learn more about recent experiences with provision of the method in public settings. The two-day learning forum that brought together 47 participants drawn from the national level and Ministry of Health, county governments, and also implementing partners, including FHI 360, to learn from one another and share knowledge on how to expand access to hormonal IUD through the public health sector. Recommendations from the meeting included as recognition of the need to incorporate the hormonal IUD into the national quantification and FP commodity supply chain management. Currently, the national MOH is considering how best to introduce and scale up the method as part of a broader effort to expand access to new and lesser used contraceptives in a sustainable fashion. This work is underway, and we will share updates as the efforts unfold. Now, I will turn this over to my colleague, Kate Rademacher, the Senior Technical Advisor, FHI 360, to close our session for today.
Thank you so much, Dr. Solomon, and many thanks to all of my co-presenters for this rich discussion and the insights from recent country experiences. As we conclude the session, we want to share a few final messages with you. First, as you consider or prepare to introduce new health products in the settings where you work, remember, you don't have to go it alone. There are many resources available, as well as lessons learned that we can leverage from recent product introduction and scale-up efforts, both within family planning and in other therapeutic areas. You can see some of these resources pictured on this slide. We want to flag a few things in particular. One is that the USAID-funded ECO and Knowledge Success projects are currently curating a list of resources related to product introduction. So stay tuned for that, and also contact us if you have resources to contribute. Secondly, the Contraceptive Technology Innovation Exchange, which is available at CTIexchange.org, has a resource library which includes a section on product introduction. The CTI Exchange is currently hosting a series entitled Beginning with the End in Mind, which will do a deeper dive on many of the topics we discussed today. So again, check that out at CTIexchange.org. Next slide. In closing, we want to thank you for joining the session. As the title of this panel suggests, there are many highs, lows, and squishy in-betweens of contraceptive product introduction. For those who are joining us live, we are now able to take your questions and comments in the chat, or you can contact any of us for more information, including Ashley and Jen, whose emails are listed here. Again, thank you so much, and we look forward to this continued conversation.